Hi guys, I'm Dr. Lucky Sekhon and I'm the host of today's episode of Fertility Fridays. We're going to be talking about why fertility preservation is a thing. Why does it exist? Well, if you talk to any woman in her 20s, 30s, 40s, and beyond, you'd be hard-pressed to find someone that hasn't been told about the term biological clock. What is the biological clock? Many people don't actually truly understand what the time-sensitive issues are when it comes to your fertility. The time-sensitive issues stem from the fact that we as women are born with all of the eggs we're ever going to have. We can't make new eggs, we can't fix our eggs or modify them over time. So there are two constantly changing data points. One is the quantity of eggs that we have to work with at any given point in our life, as well as the quantity of eggs. And this is the topic of conversation, not only in other episodes of Fertility Fridays, but it's happening all the time between women and their doctors, because this time-sensitive issue is a really crucial piece of information that every woman should understand and know about their bodies. So where does fertility preservation come into play? Well, the fact of the matter is that every month we don't have access to all of the eggs that are in our ovaries. We are able to recruit, we have this automated process where we're recruiting a cohort, a limited subset of those eggs to the surface of the ovaries, and those are the ones that are available or in use. When we do an egg freezing or an embryo freezing cycle, what we're doing is we're harnessing the quantity and the quality of the eggs that have been recruited and made available in that cycle. And if we freeze them in that state, we're basically freezing the quantity and quality of eggs or resulting embryos that we have at that given point in time. So that's the concept behind fertility preservation and why it exists. When it comes to fertility preservation, there are basically two options that are available right now and ready for prime time. You can freeze eggs alone, or you can turn those eggs into embryos and freeze them as embryos. Either way, the process is the same. It looks the same for both of those options, and we're going to talk about that in our next part of the discussion. But let's talk about the differences between an egg and an embryo. An egg is a single cell, and so it's frozen on its own as a single cell. When you turn an egg into an embryo, it's basically fertilized with sperm and grown for about a week into 100 to 200 cells, and then it's frozen at that stage. Now, who should freeze their eggs? Anyone who wants to preserve their fertility in a way that only involves them as an individual, so single women, someone who's in a relationship but not necessarily sure that they want to have children with that person and they want to kind of keep their options open. Those are some good examples of who should freeze their eggs alone. Freezing embryos is a good option for anyone in a long-term committed relationship with someone that they feel very confident that they want to have children with this person, or someone who is okay with committing to a specific sperm source. What I mean when I say that is someone who knows that they want to use a sperm donor to conceive one day, whether it's being a single mother by choice or being in a same-sex relationship, or knowing that eventually you are going to be using a sperm donor and you're okay with committing to who that sperm donor will be up front. So those would be the reasons to freeze embryos. Now, what are the differences? And I think the easiest way to frame that conversation of knowing the pros and cons of embryo versus egg freezing is to compare embryo to egg freezing. So when you freeze an embryo, the one major downside is you're locked in to using that particular sperm. So if you're in a relationship, generally speaking, when two people are contributing to an embryo that's frozen, they both have to have a say in terms of when it comes time to use the embryo. They both have to agree that they are okay with pregnancy being conceived from that embryo that was frozen. If you're using an anonymous sperm donor, then that's less of an issue because you should have full ownership of that embryo from a medical legal standpoint. So that's the one downside of embryo freezing is inflexibility. You're kind of stuck with that embryo resulting from the fertilization of an egg with particular sperm, and it can't be undone. All of the medical advantages lie with embryo freezing compared to egg freezing. What I mean when I say that is really two things. When we think about coming back to use our eggs or using our embryos, we care about thaw survival. Thaw survival rates are high across the board, whether you're freezing egg or embryos. But with eggs, an egg is a single cell, as I mentioned, so it can be more fragile. So thaw survival rates might hover between, 80 to 90%, but it can depend on your egg quality, your age, and other factors specific to that point in time when you froze your eggs. When you freeze an embryo, regardless of who you are, your background fertility or egg quality, in general, the rate of thaw survival for embryos is extremely high. When you're doing flash freezing or vitrifying the embryos, it's around 98% or more. So it gives you a little bit more reassurance that there's a high degree of confidence you're going to be able to come back and successfully thaw out an embryo and use it in the future. There's still a lot of confidence with eggs, but that statistic is more around the average of 85% versus 98% for embryos. The other advantage of embryo freezing is that you've already turned the eggs into embryos. What I mean when I say that is, not every egg is going to make it to the finish line and turn into an embryo. About 60% of fertilized eggs will make it to the day 5, 6, or 7 embryo stage. And, we expect drop off. That's a part of being a human. There's a lot of inefficiency in our bodies in the way reproduction takes place. There's a lot of drop off and attrition. So you can stop worrying about that when you freeze an embryo because you've already gotten past that stage. Additionally, when an embryo turns into a day 5, 6, or 7 embryo, it separates out into 2 cell types. Some cells that become the baby, some cells that become the placenta. So you could additionally choose before freezing your embryos to have some of those placental cells safely removed, sent off for genetic testing so that you know what you are actually freezing, and you can come back and identify of what you've frozen, which ones are healthy and normal and are useful to come back to actually conceive a pregnancy. So those are the two major differences between egg and embryo freezing. And so that, it is a very individualized conversation that needs to happen, and that's where factors such as your personal or social situation really comes into play in deciding whether egg or embryo freezing is right for you. So I want to move on now and talk about the practical day-to-day, what it looks like to actually preserve your fertility. So whether you're choosing egg or embryo freezing, the initial process looks pretty much the same. You start with something called ovarian stimulation. So this is 8 to 10 days of injectable medications that, generally speaking, start at the beginning of your period on day 2 or day 3 of bleeding. And as I said, 8 to 10 days of injecting yourself with really superficial, thin, small caliber needles, usually on the abdomen, so it's easy to access and inject yourself. You're coming in for frequent monitoring during that time, every 2 to 3 days at the beginning, and then maybe even every day for the last couple of visits. So probably about 5 to 6 visits total to our clinic to do blood work and ultrasound and monitor how you're responding to the hormonal injections. The idea behind the injections is we're trying to get all of those recruited eggs that are available in that particular cycle. We want them to grow, we want them to mature, and once we see a picture on the ultrasound that looks consistent with getting as many of them to grow as we possibly can, we then move on to the next phase, which is called the egg retrieval. The egg retrieval is a procedure that is considered a minor procedure or surgery. It's done under light sedation with an anesthesiologist. It can happen 7 days out of the week, depends on when your body's ready, not our schedule. And basically, we put you to sleep for 5 to 10 minutes, and it's all done vaginally. We use a long, thin needle. It passes through the vaginal wall directly into each ovary under ultrasound guidance, and we're able to remove fluid from each follicle that contains the egg, and that's how we pick up the eggs on both sides. In terms of what you can expect after the procedure's over, you're gonna wake up, you'll feel groggy and tired, someone will escort you home, you'll have someone pick you up because of the anesthesia, and you're gonna wanna sleep the rest of the day off. You might have some cramping, spotting, bloating. Most people feel fine the next day and are able to get back to work. But if you had a lot of eggs retrieved, you may want to take a few days to just take it easy. Things to keep in mind post-retrieval are to refrain from anything high impact to the ovaries, whether that be sex or high impact exercise, really until 1 to 2 weeks after the retrieval, usually around the time that you're getting your period. That's the time that you can say reliably that your ovaries have shrunk back down to their pre-stimulation size, and it's probably safe to resume those activities. What we're doing in the meantime is we're freezing your eggs, or we're turning them into embryos and freezing them. So for freezing your eggs, we're looking at them under the microscope. The ones that are mature are the ones that get frozen because those are actually useful to be used in the future if you want to come back to use them to conceive. If we're turning them into embryos, then that is a week-long process where we're injecting them with sperm, we're growing them for about a week, and then you have the decision of whether you want to genetically test those embryos and then have them frozen, or just have them frozen without doing that testing. And so it's really a 2-week process of concerted effort where you're coming in for close follow-up, and then really just 2 weeks of waiting for your period. Additionally, if you froze embryos, waiting to find out the results of how many embryos were frozen, and if they were genetically tested, how many of those embryos are normal. Next, we're going to talk about what it looks like to come back and use either your frozen eggs or embryos, whatever you did to preserve your fertility. So first off, if you're interested in building your family and you've previously frozen eggs or embryos, you should really speak to either your doctor that helped you with that initial process or another fertility expert to examine your age at the time you're ready to start building your family, whether you have any underlying infertility diagnosis or gynecologic problems, and to examine your overall situation. Are you in a relationship? Are you going to do this using a sperm donor? And if after that discussion or consultation, the doctor thinks that it's a good idea to thaw out the eggs and or embryos that you previously froze to help you get pregnant, I want to walk you through what that looks like. So if you froze eggs, the first initial step is thawing out the eggs and turning them into embryos. You can do this using sperm from a partner, sperm from a donor, and basically the eggs are thawed out. A certain proportion of them will survive the thaw, hopefully the majority, if you end up following the typical statistics. And each egg will be injected with sperm directly because the outer shell gets a little bit hardened from the freezing process, so they always are injected with sperm. We grow those injected eggs for about a week into embryos, and then you have the choice or ability to have us sample a small part of the embryo that one day becomes the placenta and to get genetic information. We can then freeze the embryos and you can use them for future, or we can directly transfer that embryo to your uterus. The prep leading up to that transfer, whether you're thawing out the eggs, turning them into embryos and transferring them, or just thawing out an embryo and transferring it directly, that prep is really important to understand because you don't just show up to the clinic and have that transfer done. It involves trying to recreate the menstrual cycle in an artificial way. We give you around 2 weeks of estrogen stimulation of your lining. This is usually in the form of an estrogen pill. So this starts at the beginning of your period or roughly 4 days after going off of birth control. And we stimulate your lining and thicken it up. You come in for a check of your lining once it looks thick enough. We then will schedule your embryo transfer, give you about a week of progesterone injections, and then we bring you in for this procedure called an embryo transfer. And it's really laid back, there's no anesthesia, it's not painful. It involves a speculum exam while you're in the stirrups, and it feels probably like less than a pap smear. It takes about 5 minutes. We're doing an ultrasound abdominally so that we can see where we're putting the embryo. And about 9 days, 8 to 9 days after that is when we have you come in for blood work to do your pregnancy test. Now, the most important thing to realize when you're thinking about coming back to use frozen eggs is that not every egg is going to turn into an embryo that results in a live birth. There's a lot of drop off when it comes to human reproduction. Not every egg will thaw out, fertilize, turn into an embryo, be a healthy, normal embryo that actually implants. So in general, there's like a funnel. So we say, majority of eggs should survive the thaw, maybe around 85% is the average. And around 70 to 80% of those eggs will fertilize successfully. Roughly 2/3 of those fertilized eggs turn into an embryo. Obviously, there can be some variation here, but that's the general average. And then the proportion of embryos that are actually healthy and genetically normal is going to depend on how old you were when you froze your eggs. And so that information is really important to talk to your doctor about when you're thinking about egg freezing and really examining what it means depending on how old you are when you're actually doing the cycle. So, you're going to have a certain number of eggs, but not all of them will turn into embryos, and certainly not every embryo will implant. About 60 to 65% tends to be the live birth rate when you're dealing with a known genetically tested healthy embryo. So to summarize, when coming back to use your eggs, the most important factors that will determine your chance of success of having a healthy live birth from those frozen eggs is the age you were when you froze your eggs and the number of mature eggs that you froze. Another thing to consider when you think about what the likelihood of success is when coming back to use your frozen eggs, and this is an insider's tip, is that it's really important to know what the IVF success rates are. That's going to tell you about the clinic you're considering and the quality of its lab and the methods that they use. There are some egg freezing places that might not actually go the next step and turn those eggs into embryos, and as an insider in the field, I would feel very apprehensive about that. I think it's really important to go to a large clinic that has a lab that is well honed in terms of its techniques and experience, and somewhere that has a track record where you can actually look online at websites like SART, the Society for Assisted Reproductive Technology, and that's a third party that is a regulatory body that is independently verifying different labs' success rates. And going somewhere that has a high IVF success rate is going to give you a high degree of confidence that the lab knows how to freeze your eggs well and knows what to do with them when you come back to use those eggs. So you should talk to your doctor when you're considering egg freezing about their individual lab success rates and expected rates of drop-off when you come back to use your frozen eggs. You should also speak to your doctor about your specific family building goals. How many children do you want? You should also have a personalized assessment of your ovarian reserve and a conversation about what your age means in terms of the expected proportion of eggs and resulting embryos that will actually be useful to you later down the line. You should leave your consultation with a really clear understanding of what goes into an egg freezing cycle and how many eggs you should hope to or expect to get from a given cycle, given your individual metrics like your ovarian reserve, and whether that would be enough to meet your family building goals and needs. So to wrap up, Egg or embryo freezing are both excellent options for fertility preservation. I hope that this video gave you a clear understanding of why fertility preservation exists, what it looks like to actually go through a cycle to preserve your fertility, whether you're talking eggs or embryos, and realistic expectations in terms of what to expect when you come back to use eggs or embryos that were previously frozen to start building your family. I also hope that you found my insider tips helpful in terms of when and where to consider preserving your fertility. Thanks for tuning in, and I hope to see you soon. Also, please don't hesitate to leave us any questions or comments in the section below this video, and we'll do our best to get back to you as soon as we can.